So if I invented a way to predict diabetes reliably, I would get so rich that I would be able to stop working. Because, wow, that would be amazing, right? There might be a study that you have noticed kind of floating around talking about, how do I say this again? Follistatin? Follistatin? I'm going to pronounce it that way. As a chemical that, frankly, I'm not that familiar with in our bodies. And they're saying that a elevated level of follistatin actually shows an increased risk of developing diabetes, and something that they can predict years and years in advance. There are some, obviously some very optimistic folks out there about, wow, this would be a great way for us to really head some stuff off at the pass. The question is, how reliable is this? So we're going to get very, very nerdy here. If statistics and things like that are boring to you, you will hate this video. But if you're interested in it, let's go ahead and learn some more. So in one of the longer studies that I've seen in quite some time, they followed 4,000 people from Sweden for a median of 20 years. And they followed a little over 800, between 800 and 900 in Finland for 4 years to kind of track this follistatin level in them and see if these levels were different, how many of those people got diabetes and were diagnosed as having diabetes. And bear with me, we'll put these numbers on the screen because we're going to have to put some of these up here, but we got these hazard ratios of 1.24 and 1.31, and those are the increased risks that you are going to have this disease if you have the elevated follistatin levels. So basically, you take a group with normal follistatin levels and you take a group with have the elevated follistatin levels, and they're saying the hazard ratio is the multiplication of risk, so 1.3 times more likely over here with high follistatin going to have diabetes, or 1.24 in the Finland study, and that's the risk. So it's not even a massive risk. So it's not like, hey, if you have elevated follistatin, 10 times more likely. No. It's like 25% more likely, 30% more likely. And obviously 30% more risk is a lot, right? That's not completely something you should laugh at, but it's also not a guarantee that you will have that. So let's kind of break it down a little further. So let's focus more on the Sweden study, because there were a little over 4,000 people there. They followed for almost 20 years, really, really long study. And some of the things that you kind of notice there. So first of all, they started with people at the median age of 57, which is a little bit older than I would think for trying to predict diabetes happening. I do not know the actual median age of a type 2 diabetes diagnosis, but 57 seems like a weird time to get started. I would have liked to see some younger people involved in that. I think that when most people envision Sweden and Finland, they probably picture a pretty racially homogenous group, and so it's not going to be the most diverse population. If you're from a pretty metropolitan area, if you're from Toronto, if you're from one of the major cities in the United States, if you're from another major city in Europe that has a lot of racial diversity. So maybe there's going to be some differences there if your racial makeup of your country doesn't match what Sweden and Finland are currently dealing with. But still, only a 25 or 30% risk difference. The other thing is their BMIs were different than I'm thinking here in the States. So in the United States, the average BMI is approaching 30. BMI is a calculation of how heavy we are. If you've watched American medical news, you've heard about the obesity epidemic, and we're pushing 30 now. These folks were at a median of 25. So good on you, Finland and Sweden, for trying to stay healthy on the weight front of things. But some of our demographics might be a little bit different here. So if you're watching this from the United States, if you're watching this from another country that has some different demographics than Finland and Sweden, this may not all be 100% applicable to you in the same way, but it's interesting stuff. So the real question is, what do you do with this today? And the reality is, if you're not a scientist, the answer is probably nothing, right? It's a neat idea, and I think that the notion of if follistatin testing becomes much more reliable in the sense of being able to predict things, will we see follistatin testing becoming part of our general screening? I don't know. I think that the risk factors for developing diabetes are things that we all kind of understand, in the sense that if we eat better and if we control our weight, we can in some ways influence where our insulin sensitivity goes. I think that it's also important to understand that not everyone who has diabetes did it to themselves, right? This is not a thing where Well, if you just live different, you would never have diabetes. There is a large genetic component to this. There's a large nature and nurture component to this. If you look at the facts that type 2 diabetic parents are more likely to have type 2 diabetic children than type 1 diabetic parents are to have type 1 diabetic children, you understand that some of this stuff just gets handed down to us. So if you have diabetes, I don't want you to beat yourself up. I want you to work on treating yourself with your physician and your team. If you're nervous about ending up with diabetes, understand you should just try to live a good, healthy life at this point and try and let go of that emotional stress that comes with constantly worrying about something that you may not be able to control anyway. Just worry about the things that you can. And today, I don't think that follistatin is a reliable enough of a thing that we're going to be able to take a follistatin test, do something, and prescribe something different to you, prescribe some medication to you, and fix the chance that you're ever going to have diabetes in the future. It just doesn't seem to be there yet, right? But a 20% or 30% increase over a lifetime of ending up with type 2 diabetes if you have elevated levels of this in these 2 trials certainly means the scientists have stuff to do, right? We should do some better trials on this. We should figure out if there's ways that if this is more applicable to other demographics, younger people, older people, and are there interventions that we could apply to those with elevated follistatin that will change then not just their follistatin levels, which may be irrelevant, but will actually change their odds of ending up with diabetes. It's really interesting stuff, and on a nerd level, I love it. Hopefully we can get some more and promising information out of this in the future. Thanks.